There are growing delays for Texas safety net programs. Data from the Texas Health and Human Services Commission shows backlogs for Medicaid and SNAP applications have surged this year. We want to learn more about this now from Diana Forrester. She is the Director of Health Policy from the nonpartisan nonprofit Texans Care for Children. Diana, welcome to our show and thanks for taking the time today.
Thank you so much. Happy to be here.
First, give us a sense about the scope of this problem. Just how large have these Medicaid and SNAP backlogs become in Texas?
Yeah, we're really concerned that Texans are stuck waiting longer for health care and food assistance. Beginning at the start of this year in January, Texas only had about 2,000 Medicaid applications that were stuck in the backlog, but that number has really skyrocketed. We now have 183,000 Texans stuck waiting for the state to process their Medicaid application. This is a problem. We want to make sure that pregnant women can start their prenatal care quickly and that kids, if they're sick, can see their doctor or get a checkup if they need to.
You touched on it there, but I'm hoping you can help us better understand about what a delay in an application for getting those Medicaid or SNAP benefits can really mean for a family.
Yeah. Another number that really jumps out to me from the state is that half of applicants are waiting at least 70 days for an eligibility worker to even begin processing their case. That means a family has done everything right. They've completed their 30-page application. They've uploaded their documents, and they are just waiting over 70 days for a worker to even start that process of processing that application. I mean, for a family, 70 days is not an administrative delay. That's 70 days where you're waiting to know if your kid's going to have health coverage or whether you can get prenatal care and check your baby to make sure it's okay, whether you can afford medication you need.
And you all shared in a report that some of this may have to do with technology. What is the factor there? Can you explain more about that?
Yeah, so part of the challenge is the state is moving extra slowly right now to make sure it's meeting these new federal standards for accuracy, particularly with the SNAP applications. But we got to find a way to be accurate without creating these significant delays, which is why we would like the legislature and state health officials to kind of join together and take a look under the hood. Let's diagnose some problems and develop some solutions. We know that the legislature made a great investment in improving the technology of the enrollment system last session, but that's going to take several years to fully implement.
I want to ask you more about that in just a few moments, but I'm also curious about some of the changes that there have been to SNAP work eligibility requirements. Has that played a role in this as well?
Yeah, I mean, there's a couple things happening at the same time. Texas already has an aging eligibility system that has struggled to keep up with demand. And this year, they've had to take on significant new SNAP requirements that have come out of the federal budget law. And it includes those new work requirements. So that's meant changes to the technology and additional training for roughly 6,000 eligibility workers. Those demands are landing on a system that was already under strain.
And are there any other problems that you all have identified or could point to that kind of created more of this backlog and some of these issues?
We can't point to one single cause for the entire backlog, but what we see clearly is that the system is falling further behind.
So we want to look ahead to the upcoming 2027 regular legislative session. That begins in January, so not too far away here. You spoke about it a moment ago as well, but what are some of the things that you all are recommending to lawmakers or things that they should consider going into that?
Yeah, there are steps that the legislature and our state health officials can take so that families aren't facing such long delays. One example would be we would love to see state health officials hold in-person enrollment events in the community and partnering with community organizations. They've done this before when the need has been really extreme and they've been really successful.
All right, we will have to revisit this conversation once the session begins to see where things go from there. But Diana Forrester with Texans Care for Children, thanks again for being here with us today.